All right. How to recognize high or low blood sugar? Well, what is a high blood sugar? First, do you remember what a blood sugar is? Well, it's a measure of how much sugar is in your blood. And how do you find out how much sugar is in your blood? You use a tool called a glucometer. It is a glucose monitor or a sugar monitor. Anyway, you use your glucometer to see how much sugar is in your blood by pricking your finger and putting a drop of your blood into the machine. In school, any score between a 70 and a 100 is passing. This is how you should remember your target range for your blood sugar. You can use this figure for an example. Now, most people don't realize that they have a high blood sugar until they get above a 180. So that is why it's important to measure your blood sugar a couple of times every day instead of waiting until you feel different. With high blood sugar, the first thing people notice is that they pee a lot. If you notice you're peeing a lot, you should go stick your finger with your glucometer to find out if your sugar is too high. Lastly, why do you think many patients with diabetes get a high blood sugar? It is because they stop taking their meds. It is important to remember not all meds work the same for everybody. So if you're taking your meds like you're supposed to, and you develop a side effect, or you can't keep your blood sugar below 100, talk to your doctor. You may need to try out a new medication. What are some other signs of high blood sugar? If you are more thirsty than normal, feel like you can't drink enough water to quench your thirst. These are very common signs of high blood sugar. As a matter of fact, drinking a lot of water and peeing a lot are the biggest signs of high blood sugar. With that in mind, there are still some others to look out for. You may notice feeling more tired and confused, or changes in your vision. If you notice any of these things, it is important for you to check your blood sugar, as this may mean your sugar levels are getting too high. Now, it is important for you to know when your sugar is getting too high, because the management of diabetes and prevention of serious problems down the line all come down to keeping your blood sugar in the target range of 70 to 100. If you can keep your blood sugar in this range, you pretty much eliminate the risk of problems down the line. So, learn to recognize these signs of high blood sugar and be good about checking your sugar frequently. Again, these signs include feeling very thirsty, peeing a lot, and feeling very tired. Like it's hard to stay awake. You keep drifting off. You're feeling drowsy. So, what should you do if your blood sugar is high? First, ask yourself, have you took your diabetes medication? A lot of times this is the cause. And if you forgot to take it this morning, go ahead and take it now. 2, start drinking lots of water to replace what you're peeing out. Remember, because you pee out a lot whenever you have high blood sugar. So it is important to replenish those fluids. 3, recheck your sugar 30 minutes after taking your missed dose. 4, if your sugar continues to rise, for example, above 350, or you feel like you may pass out, call 911. So, if you have a high sugar, drink water, take any missed medications, and recheck again in 30 minutes. And if you have a reading that's above 350 or feel like you're going to pass out, call 911. Using your sugar monitor, if you get a reading above that is below 70, means that you have low blood sugar. Remember, 70 to 100, that is the target. You want your blood sugar to be in this range. That means you're successfully controlling your sugar. If that number gets above 100 or below 70, then your sugar levels have fallen out of the target range. Now, most people don't notice that they have a low blood sugar until they get below 55. This makes most people feel weak and dizzy. So if you start to feel different, go ahead, just be safe and check your blood sugar. A common reason people will get a low blood sugar is because they took their diabetes medication without eating. So make sure you understand how you are supposed to be taking your medications and talk through them with your doctor. Now, many people without diabetes have experienced symptoms of low blood sugar before. If you've ever missed a meal or two and started to feel dizzy, short-tempered, and confused, maybe your heart was beating faster than normal, you may have had a low blood sugar. Patients who skip meals while taking their diabetes medicine may end up dropping their sugar too low and start to feel different. Many people behave differently when their sugar gets low. They get, again, short-tempered, sleepy, they feel dizzy. A lot of times their hands get shaky. And when it gets really low, they sweat a lot. So what should you do if your sugar gets low? Well, first, do you remember what a low sugar is? That's right. It's a reading below 70. And you may start to feel symptoms whenever it drops below 55. Now, if you get a reading that shows you have a low sugar, you just need to eat sugar to fix it. Many patients try to keep hard candy like Jolly Ranchers with them in case they start to get woozy from a drop in sugar. Candies work well, but the quickest solution is fruit juice. So if you ever get a low sugar, eat some candy or drink some juice and recheck the level in 15 minutes. If you are alone and start to feel drowsy or your sugar is staying really low and you can't get it up, call 911. Alright, so big things to remember. Your target range for blood sugar is a passing grade in a class of 70 to 100. And when you start to feel different, like you're thirsty or dizzy, you are probably way outside of that normal range. If you're below 55 or above 180, it's time to take action. For low blood sugar, you should drink juice or eat candy. For high blood sugar, you should drink water to replace those fluids you lost, and take meds if you missed a dose. Remember to recheck your sugar levels after you take action to make sure that you're moving in the right direction. If you are frequently having to recorrect your sugar levels and developing symptoms, talk to your doctor. They will want to know this information.